Welcome to Dog Cancer Answers. I'm James Jacobson. Cancer, unfortunately, is the #1 killer of dogs around the world. And we've put together this information series at Dog Cancer Answers to help answer many of the questions that you may have if you find out that your dog has cancer. We have two distinguished veterinarians with us. These are the authors, co-authors of the book, The Dog Cancer Survival Guide. We have Dr. Damian Dressler in Hawaii and Dr. Susan Ettinger in New York. Let's find out a little bit about these veterinarians first, and I'll go to you first in Hawaii, Dr. Dressler. Tell us a little bit about yourself. You are known as the dog cancer vet. How did that start?
Well, it started many years ago. I own a small animal practice with 3 doctors, and one of the things that I noticed was that we had so many dogs coming through the door here in Hawaii, which is a pretty healthy place to live, that received a diagnosis of cancer. And as time went on, I began to get frustrated because I felt that the treatment options were limited. So I started, or embarked really, on a really long journey, trying to find any way that we can help dogs with cancer improve their lifespan and improve their life quality. And over many, many months and years of this research, was able to amass quite a body of information that could help dogs with cancer. And that's what led to the Dog Cancer Survival Guide.
And of course, you have the blog, Dog Cancer Blog, which is turned to by veterinarians and dog lovers all over the world. Where'd you go to school?
I'm a Cornell University graduate and have been in practice for 14 years, and I probably log 60 to 70 hours a week in the veterinary practice or veterinary-related work. Let's
turn to your co-author in New York. Dr. Susan Ettinger is a veterinary oncologist. Tell us a little bit about yourself and how you got started, Susan.
I actually am also a Cornell grad. I graduated, was actually friends with Dr. Dressler in vet school, but after my internship I decided to specialize in oncology, and so I did a residency exclusively in medical oncology, where you get a little training in radiation oncology, and I've been in veterinary oncology practice, I guess, for about 8 years now.
Now, you both approach dog cancer from slightly different perspectives. Obviously, Dr. Ettinger, you are an oncologist and you primarily focus on chemotherapy. Is that right?
Yeah, so pretty much all I do day in and day out is deal with and treat dogs and cats with cancer, and that's exclusively what I do. Most guardians that bring their dogs and cats to me already have a diagnosis of cancer, and so my specialty is medical oncology, meaning chemotherapy, whether it's oral or injectable chemotherapy. But it's really my job to navigate the confusing world of oncology in general, and I work very closely with our surgeon, and she specializes in oncologic surgery, and also I work very closely with our radiation oncologist. So it's a very team-oriented approach in managing our dogs.
And Dr. Dressler, in Hawaii, you don't focus on chemotherapy. You're not specifically a veterinary oncologist. Tell us a little bit about that.
Well, that's exactly right. And as it turns out, we actually don't have board-certified oncologists like Dr. Ettinger here in Hawaii.
Anywhere in the state?
Anywhere in the state. There are not that many oncologists to go around, as it turns out. So we're in a position here, the clinicians out here are in a position where we have to, if we want to be using or get input from oncologists concerning chemotherapy, radiation and or surgery, these need to be done virtually, telephone or online, but we're in the trenches, which is an interesting thing because what it forces us to do is delve into areas that we normally wouldn't, because on the mainland, the continental United States, there are specialists to turn to. So in a way, it increases the breadth of what we do simply out of necessity. And in the area of chronic disease, this is something that I've jumped into with both feet because I wanted to see if we could do better. I wanted to see if we could help dogs with cancer and their guardians in a more broader approach where we can deal with not only the emotional issues by providing certain tools that can help during the dog cancer journey for a guardian, for a human dealing with a dog cancer diagnosis, but also addresses all of the different areas that up to this point have been very disorganized and unexamined. Diet and supplements and outside the box therapeutics and acupuncture and homeopathy and touch therapies, all these different things that up to this point have not had a very critical evaluation to say, okay, what really works here in this quote-unquote alternative compartment and what really does not. So we combine that with Dr. Ettinger's expertise, and we have a very formidable arsenal for dealing with canine cancer.
And this entire video series, this entire Dog Cancer Answers series, which you can view on dogcancer.tv on the internet, is based in part on just some of the information that is in the Dog Cancer Survival Guide in your book. Dr. Ettinger, as viewers go through and watch different videos in this series, is there anything that you would advise them to keep in mind?
I think the reason that I got involved in this book is I wanted to add my expertise and my opinion to people who just got the heartbreaking diagnosis that their pet had cancer, and I wanted them to hear, in my perspective, why chemotherapy may not be that bad, and there's a lot of the preconceived notions that we all think about with chemotherapy and how horrible and why would you ever do that to my pet, that I wanted them just to hear my perspective of why, of what it entails. And so that's why I really got involved. But it's really been quite a journey for me. And what I think is interesting is that people may be surprised. They may learn that chemotherapy is not as bad as they thought it would be, and that holistic medicine might be something they want to integrate into their dog's chemotherapy protocol. And so I really hope that people go into the book with an open mind, because I've learned a lot by being involved in this book, and I hope Dr. Dressler has as well.
Dr. Dressler, your thoughts about both the book and this video series?
Absolutely. It's been such a process, really such an odyssey, because, for both Dr. Ettinger and myself, we're both so immersed in what we do, much more so, I think, than other veterinarians, at least in this particular slice of medicine, which is the area of canine cancer, with her expertise every single day dealing with the conventional aspects, and mine every single day dealing with the non-conventional aspects. And it's been very, very, I think, beneficial, not only to both of us as clinicians, but also to the end product, because what we've been able to do is to put out something that is very, very far-reaching in scope, in a much more, I think, logical and kind of nuts and bolts and also supportive way than perhaps has ever been done before.
Well, I want to thank both of you veterinarians for putting this book together and joining us for this video series. Already people around the world have been benefiting from it, and will continue to do so. So Dr. Ettinger in New York, Dr. Dressler in Hawaii, thank you so much.
Thank you.
Thank you.